This is ABC News Nightline.
Back then, the press was reporting that patients were infected with an already familiar virus.
Chronic Epstein-Barr virus syndrome.
Epstein-Barr was eventually ruled out, but the government's favorite explanation for the disease, that its cause was in the mind, remained. The National Institutes of Health lead researcher appeared on Nightline.
From my own research, I know this disorder is so subjective that patients will commonly feel better no matter what you give them.
Physicians everywhere followed the government's lead, and patients like 13-year-old Sky Daler in Rochester, New York, would go from doctor to doctor, only to be told it was all in her head.
They were convinced she was crazy. They said, she just doesn't want to go to school. There's nothing wrong with this girl.
The kids at school made it worse for Sky. Many teased her and refused to believe she was sick. Some even ostracized her, saying she had AIDS, refusing to sit with her in the cafeteria. Finally, her mother found David Bell.
I can't even tell you how we felt. It was, you mean we're not crazy?
Meanwhile, in 1988, Cheney had another lead, Elaine DeFreitas, a bright young scientist studying the link between multiple sclerosis and an immune system virus. Because MS had some symptoms in common with chronic fatigue syndrome, DeFreitas agreed to test some of David Bell's patients, including 13-year-old Sky, for the viruses she was working with.
And to my surprise, a number of these patients were positive. We didn't know what it meant. But we felt that we had to pursue it further, and if the data held up, we had a responsibility to tell the scientific community what we found.
What she found was the first evidence that the patients might be infected with a new immune system virus. DeFreitas' findings were something to tell the world about. But on the night she, Bell, and Cheney were leaving for a meeting in Japan to announce their discovery, David Bell was paged in the airport. It was an emergency room doctor in Rochester, New York, who was trying to resuscitate Sky Daler. That day, a classmate of Sky's had cruelly suggested she go home and kill herself. David Bell listened over the phone as 14-year-old Sky died from an overdose of pills.
She died for no reason. No one should have to suffer that way. Nobody.
It was too late to help Sky, but Cheney and Bell thought the CDC would be interested in DeFreitas' major discovery. Once again, they were wrong.
Even though this was in every major paper, headlines all over the world, no comment from the federal government. Absolute dead silence.
Eventually, the CDC wrote a paper dismissing DeFreitas' findings, but she pushed on, finally isolating a new virus, seen here for the first time, which she believes may be one of the causes of chronic fatigue syndrome. It is a virus that attacks the immune system and can lay dormant for years. But DeFreitas says the government has ignored her discovery. We asked to speak with the Centers for Disease Control and the National Institutes of Health about chronic fatigue syndrome, but they refused. Instead, Dr. William Reeves, the man in charge of investigating chronic fatigue for the CDC, told us over the phone that 1, there is no viral cause for this problem, 2, there are no immune system abnormalities in patients with chronic fatigue, and 3, there are no clusters. So when asked about the illness at Lake Tahoe, he said that was hysteria.
If they admit to a cluster, then they must say it's infectious. And I don't think the CDC wants chronic fatigue syndrome to be considered infectious.
The government finally did put someone forward to talk to us, Dr. Philip Lee, Assistant Secretary of Health.
Do you believe in clusters?
Do we have clusters of cases? Oh, yes, I do.
Dr. Reeves told the producer for this piece that, in fact, the Lake Tahoe cluster didn't exist, and the people living there are hysterical.
Well, again, that's his view.
But he's a scientist at the CDC. He's responsible for investigating these kinds of things.
The CDC did investigate that. They reached certain conclusions which many people disagree with.
Do you believe it's a virus?
I really don't know.
If you had to take
well, I would guess,
academic
I would say it would be a retrovirus or a virus. I would think so.
Lee says the government is making progress. But Hillary Johnson, whose book is being released today, remains unconvinced.
I think it's one of the most incredible medical stories of our century, and it's going to be very, very hard for the government to change its position on this disease. To have to sort of call up the American public and say, hey, you know that disease that we've been calling chronic fatigue syndrome for the last 10 years? Well, guess what? It's really something far more serious, and it's transmissible. And we made a mistake in Tahoe, and we've been making a mistake ever since.
The debate inside the government continues about what causes chronic fatigue syndrome and about whether it's contagious. There is no treatment for the disease itself. Doctors can treat only the symptoms that patients continue to suffer.